Let's talk about breast abscess. What are the causes of breast abscess? In lactating mother, crack by the children during suckling, and the causative organism is Staphylococcus aureus. The commonest organism responsible for breast abscess is Staphylococcus aureus. Now, classification of breast abscess. According to the disease course, it may be acute breast abscess or chronic breast abscess. According to the site, it may be intramammary within breast tissue or subareolar from areolar sweat or sebaceous gland of the Montgomery, and retromammary from behind the breast tissue in the chest wall. Now, clinical features. In case of acute breast abscess, it is most common during childbearing age, and continuous throbbing pain, lump, fever, malaise and anorexia may be present. Pus point may be seen. Overlying skin is red. The lump is hot and tender, and fluctuation may be positive if superficial present. It may be fixed to skin and underlying structure. Transillumination test is negative, and axillary lymph nodes are enlarged, firm and tender. In case of chronic breast abscess, there is a past history of the acute breast abscess, and a hard, painless or non-tender lump may be present, and it may be fixed. Investigations that can be done include blood for total count, differential count and ESR, and careful aspiration. If pus is present, it is confirmatory. Now, treatment. Immediate surgical drainage of the abscess under general anesthesia. Pus is sent for the culture and sensitivity. Appropriate antibiotics, analgesics, bed rest and support to the breast. Lactation should be withheld, but the healthy breast may be used. Emptying of the breast manually or by breast pump, and regular dressing of the wound can be done. Now, steps of the drainage of a breast abscess. A radial incision is given over the sited segment. However, if adequate access to the affected area is allowed by a circumareolar incision, then this will be preferred for a better cosmetic result. Incision passed to the skin and the superficial fossa. A large hemostat is then inserted into the abscess cavity. Every part of the abscess is palpated against the point of the hemostat, and its jaws are opened, and all loculi that can be felt are entered. Finally, the hemostat is withdrawn, a finger is introduced, and any remaining septa are disrupted. The wound may then be lightly packed with ribbon gauze or a drain inserted to allow the independent drainage. Now, principles to be followed before making an incision. Incision of a lactational abscess is necessary if there is marked skin thinning, and can usually be performed under local anesthesia. If analgesic cream such as lidocaine is applied 30 minutes before surgery. The usual incision is sited in a radial direction over the affected segment. Although if a circumareolar incision will allow adequate access to the affected area, this is preferred because it gives a better cosmetic result. A counter incision may be